My name is Andrew Brown. I'm one of the vitreoretinal surgery disease experts here at the Gavin Herbert Eye Institute, and I care for patients with diseases like macular degeneration, diabetic retinopathy, vein occlusions, retinal detachments, and macular holes. Macular degeneration is a condition that affects people with advanced age. That's why it's called age-related macular degeneration. It is something that is a slow but progressive decline in vision over a course of many years. There are two types of macular degeneration, the dry form and the wet form. In the dry form, there's a loss of the cells that support the retina, and you have this gradual loss of contrast vision. In the wet form, new blood vessels start to form underneath the retina, and those new blood vessels can leak fluid or they can bleed, resulting in vision loss. The treatment for both of them is always first starting off with prevention. And patients can also take the AREDS, age-related eye disease study vitamins. These are a cocktail of antioxidants that slow down the progression of the disease. We are living in an age where people with the wet form of the disease are able to maintain their vision with a group of drugs that are injected directly inside the eye and that allow the blood vessels that have formed to regress or stop leaking. While wet form of the disease has received the most attention, there's a whole cadre of new treatment modalities that are being investigated all around the world to try and treat not only the wet form and make it a better treatment, but also to try and address the dry form of the disease. These treatments are aimed at trying to prevent the cells that form the foundation underneath the retina from gradually stopping their function. Some of these treatments are in the form of medications that are put inside the eye. Some of these medications are even eye drops or medications that can be taken by mouth. One of the forms of the treatments that you might hear about the most are stem cell related therapies. And while there are no stem cell related therapies that are approved for the treatment of macular degeneration yet, this is a very exciting time because we will find something that we can use to try and replace cellular function. Thank you for joining us in our discussion about AMD and in this effort to try and help raise awareness and the knowledge about AMD.